Hi, my name is Anish Desai, and my poster is titled, Having a Rough Time Healing, Hematogenous Spread of Pasteurella Causing a Prosthetic Joint Infection. We follow the case of a 66-year-old male with a total hip arthroplasty in 2015 and a calcaneal osteotomy done 2 weeks prior who presented with acute on chronic hip pain. 4 days prior to admission, he noted progressive pain and fevers, as well as new exudative drainage, erythema, and swelling from his left heel wound. Labs on admit were notable for a leukocytosis of nearly 19,000 and elevated inflammatory markers. Hip aspiration showed turbid fluid with over 100,000 white blood cells, for which cefazolin and vancomycin were empirically started for presumed prosthetic joint infection. The next day, he was taken to the operating room for an arthroplasty washout with findings of joint purulence without hip capsule violation or compromise of femoral or acetabular components. A calcaneal biopsy was also conducted due to concern for osteomyelitis. Hip synovial cultures as well as bone cultures ultimately both grew Pasteurella multocida. Upon further questioning by the infectious disease team, our patient later admitted that his dog had been licking his calcaneal wound site since splint removal about 1 week ago. Prosthetic joint infection was suspected to be due to hematogenous seeding via saliva inoculation of his left foot wound. Given the time frame, the organism was thought to have only been in the joint for several days, limiting biofilm formation, thereby increasing chances of cure with just washout and antibiotics. Therefore, his hardware was not removed. Once the organism resulted, he was switched to fluoroquinolone for a total of 6 weeks therapy, with sensitivities confirming antibiotic selection. After completion of antibiotics and follow-up, he had a non-significant CRP, his hip pain had resolved, and his left calcaneal wound had healed. While Pasteurella multocida is a common cause of infection following bites and scratches, licks are a rare cause of tissue inoculation. It was postulated that the prosthetic joint infection was due to repeated exposure of an open wound to saliva. This organism typically manifests as a distal cellulitis, and septic arthritis as well as prosthetic joint infection are rare and generally reserved for joints proximal and distal to exposure sites. Similarly, osteomyelitis from Pasteurella multocida is rare and usually attributed to direct inoculation of bone periosteum via bites or scratches or direct extension of overlying cellulitis, and generally also occurs in only immunocompromised patients. Our patient's right hip prosthetic joint infection and left calcaneal osteomyelitis were initially presumed to be separate and unrelated occurrences. However, both sites grew Pasteurella. This indicated likely hematogenous spread from the left calcaneal wound to the right hip arthroplasty. Bacteremia with this organism more commonly occurs in immunocompromised patients and also appears in a bimodal age distribution. Additionally, reports of hematogenous prosthetic joint infections with Pasteurella are fairly sparse in the literature. While this organism can be rapidly progressive, it responds well to antimicrobial therapy. There was limited history initially obtained regarding the calcaneal infection without noted questioning of wound exposures. Directed questioning, especially in the setting of a recent open wound, as was done by the ID team, may result in acknowledgement of the animal risk factors allowing earlier tailoring of antibiotics, particularly since standard therapy for prosthetic joint infections such as anti-staphylococcal penicillins and vancomycin are suboptimal for this organism. Our patient with Pasteurella not only developed his infection in a rather unique way, but also manifested in a way that is very uncommonly seen in non-immunocompromised patients. In follow-up, he responded well to tailored management and has been recovering appropriately. The main learning points to take away from this case are to recognize that Pasteurella is generally spread by bites and scratches, however, it can also be caused by licks in the setting of an open wound. In addition, one must understand the importance of early identification of this organism, as standard therapy for prosthetic joint infections are suboptimal. Additionally, we must also consider counseling patients with internal hardware about avoiding contact between pet saliva and open wounds. This concludes my poster presentation. I appreciate you all for taking the time to listen to this case. Thank you.